Okay, good afternoon, everyone. I am Professor Terence Simangal, and I'm the Dean of the Faculty of Medical Sciences and the Deputy Principal, our much-loved Deputy Principal, as you know, in charge of students. He has asked me to have a presentation from the Faculty of Medical Sciences on vaccines. So kindly permit me to introduce my team. We'll begin with Ms. Melissa Jack, who is the chair of the Medical Sciences Student Council. She's a year 4 medical student. And she'll talk about COVID-19, a student's perspective. I'm not leaving out the staff here. It's just that the majority of the people present are students, and I thought it would be nice to hear the views of a student. Professor Aura, a world-renowned professor of virology from the School of Veterinary Medicine, will talk on tackling the root of it all, an overview of the types of SARS coronavirus 2 variants and why variants are important. Our Deputy Dean for the clinical programs, Dr. Sandra Reed, herself a well-known psychiatrist, will speak on mental health effects of the COVID-19 pandemic among students. Dr. Carla Maria Alexander, our lecturer in immunology from the School of Medicine, will speak on the different vaccines available in Trinidad and Tobago. What are they, and what are the common and rare side effects? Dr. Philip Onoa, the acting director of the School of Nursing, will talk about how the vaccine is administered and what may happen within the next day or so following vaccination. Having heard all of them, I will then talk a little bit about the advice that a clinician would give to a patient who is considering vaccination. That is, how to balance the risk. So our presentations are short because we want to hear from you any questions that you may have. And I will now ask, if the chair will permit, I would ask Ms. Melissa Jack, our year 4 medical student, to talk about a student's perspective on COVID-19. And after this, because the presentations are short and I don't want to lengthen the program unnecessarily, I won't say any more until it's my turn, and I'll just ask the speakers to roll one into the other, and each one can then introduce himself or herself very briefly again. So Ms. Jack will be followed by Professor Aura, Dr. Reed, Dr. Alexander, Dr. Onoa, and then me. Thank you very much. Go ahead, Melissa.
All right, so good afternoon to everyone present. My name is Melissa Jack. I am a 4th-year medical student, and I am the Faculty of Medical Sciences representative on the Guild of Students. I thank Professor Simangal for giving me the opportunity to just share a little bit on the students' perspective. I know we are all students here, and you know, it's not something that can be summed up in one word. Some of the words I've heard so far on, students' perspective of COVID is a strange time. It's unprecedented times. It's very difficult. The pandemic would have come and it would have given very devastating impacts on our student campus life, student activities. And, it's a Thursday evening. So this would have been the time that we would have had to earlier in the day to be free with our clubs, different activities, and it's not something that we can partake in right now. I think if we could all just sit a minute and think of where in the university we would have been right now if we had the opportunity to be on campus. A lot of persons would have like their favorite spot that comes to mind. However, given the situation that we're in currently, it's not fully available to us. I would have asked some students, informally on my Instagram, what is your perspective of COVID? Because I would have my perspective and, I would bring that across, but I would just take 2 minutes to just let you all know some other students' perspectives, because I think it's important for us as students to realize that we are not alone in this, and your feelings are valid. You know, a lot of the responses that I would have gotten is that it's mentally tasking. We just want it to be over. Some students feel that the restrictions are very necessary, but it's getting to the point that it's mentally tasking. It's just overwhelming, and we have someone who will speak about it later on, right? So just know that whatever your feeling or perspective of the COVID-19 pandemic is, it is valid. And to get to the meat of the matter today, it's vaccinations. And I think, as with any bad situation, there's always a light at the end of the tunnel. And for us, that would be vaccination. But not vaccinations coupled with still following the health regulations, the guidelines, those 3 Ws that we will be hearing all the time. And I want to encourage everyone to take the information that is going to be given to us today. I'm very happy that we didn't have to look far outside of our faculty, of our university, to find professionals that have the knowledge, have that information, that can give you, the students, that information. I know we have persons who may be skeptical or have hesitancy within taking the vaccine or have questions, and I would say that's valid. However, take it as a final project or a research project. You wouldn't take any messages that you just see on WhatsApp or Instagram, any other social media, and put it on a research paper, give it to a lecturer, and expect to get full marks. If you have questions about anything, make sure and ask them. Do your research. If you have questions, make sure your sources are valid. And we have a wide wealth of knowledge within the presentations this evening. So here's where I'm going to advocate heavily for all students to get vaccinated, get your friends or families vaccinated, so that we can really merge into campus life, that university aspect that we love so much. And here I would just hand it over to the next presenter. And I hope that you're able to take the knowledge. And if you have any questions, feel free to ask them. I know any of the presenters here would be welcoming and answer all of your questions.
Hello, a very good evening to everybody. My name is Chris Ora. I'm just going to share my screen with you very briefly, hopefully. So I'm going to talk to you today. Let me just get that up. I'm going to talk to you today very briefly, and good evening, by the way. I'm going to talk to you very briefly today on the types of COVID-19 variants and why these variants are so important. And I want to just start off by saying that viruses are in the business of survival. And how do they do this? How do they survive? They change and adapt. And this is what we're seeing with COVID-19. And they do this, and we're seeing that COVID-19 virus is doing this in 2 ways. Enabling them, one, to replicate more efficiently, so they become more transmissible, which we're hearing about. And the other thing is they're evading the immune response, so they're getting around the vaccine. And this gives them the advantage in a population. And I wanted to introduce to you very briefly this blue protein here, this spike protein on the surface of the virus. Now, this is really critical because it's produced by RNA, which you see here during viral replication. And as this RNA replicates, it makes errors. Naturally, it makes errors, which change the shape, because the RNA produces the spike protein, and the errors result in a change in the shape of the spike protein. And why is this important? This is important because the spike protein interacts with cells, here we see, through a receptor on the surface of the cell. And it's like a lock and a key. So the spike protein is like a key and the receptor is like a lock. So if we get mutations in the virus and the shape of this spike protein changes, enabling it to fit better, more efficiently into the receptor, more virus is able to get into the cell. When more virus gets into the cell, more virus is produced by the cell and excreted by the cell, and we transmit more virus. And this results in increased transmissibility. Also, the same thing, the spike protein also interacts with antibodies and T cells, which are the important part of our immune system. So again, if a mutation happens and the shape of that spike protein changes, antibodies, here we see in white, can no longer interact efficiently and bind to that spike protein, so they can no longer neutralize the virus. In other words, the virus is not neutralized by antibodies, not killed by T cell, and it's able to survive. So this is what the virus is doing. It's surviving. And we're seeing at the moment these different variants. And you know about them. They're called alpha, beta, gamma, and delta after the Greek alphabet. And what we're seeing in these is combinations of improved or increased transmissibility. And in some cases, they're able to partially, at least, evade the immune response. This alpha virus was about 50% when it appeared in the UK, 50% more transmissible than the original virus. The beta and the gamma viruses, the beta was from South Africa, the gamma from Brazil that we have in Trinidad and Tobago. These are also were more transmissible, but they're also able in a small way to be able to evade the immune response. And then we have this guy on the right, the Delta variant, which is the one we're really worried about, which is spreading so wildly around the world. This one is becoming dominant in the world at the moment because it's around 50% more transmissible than the alpha variant and around 75% more transmissible than the original virus that came out of Wuhan. So there's important take-home messages that I wanted to come out to bring out to you here, is that the SARS-CoV or the COVID-19 virus is constantly mutating and changing. This is normal. It's producing new variants, and it's going to continue to produce new variants as long as it is replicating out of control around the world. This is how the virus survives. This is the strategy that it uses to survive. And the Delta variant is, as I said, far more transmissible than other variants. So it's a very, very dangerous variant, and we really don't want this Delta variant in Trinidad and Tobago. And to stop new variants, we have to stop the virus, because every time the virus replicates, it makes these errors in replication due to mutations. And this could, if it produces a variant that is has an advantage in the population, that variant will gain dominance. So we need to stop the viruses from replicating everywhere around the world to stop the variants. And lastly, the good news is all current vaccines are safe and effective against all current variants. So when it's your turn to get a vaccine, please say yes to protect yourself and to protect your communities, protect your countries, and to protect the world. Thank you very much.
Good evening, everyone.
Stop sharing. Stop sharing. Okay.
Yes. Good evening, all. I'm Dr. Reed, and at this time, we'll take a pause from vaccines and have a conversation about the mental health effects of the COVID-19 pandemic among students. Alongside the COVID-19 pandemic is a mental health pandemic driven by uncertainty, fear, loss, life setbacks, as well as too much information, factual and error. That is why sessions like these are so important, to separate the fact from the fiction. Further, each individual has the stress associated with their particular circumstance, whether it's trying to balance working from home while supporting online school for children, trying to make ends meet after job loss or a salary cut, or trying to finish a university degree. Our students are under a lot of stress, we know that. A telling picture was painted by one of our student associations in the Faculty of Medical Sciences, who surveyed all of their student body concerning their mental health. Their survey was triggered by reports of wanting to self-harm among the student body. 87% of students in that school reported feeling stressed. 85% felt anxious, 58% felt depressed. When asked to rate their mental health, 54% reported that their mental health was poor or very poor. In fact, 12% of them said very poor. Whatever the baseline rates might have been, this is a high prevalence of self-reported stress, and it is likely that in other schools and faculties, the trends are the same. For 91% of students in that survey, the stress was related to school, and 65% was stressed by non-academic causes. There is undoubtedly need for intervention to safeguard the mental health of our students, who studies have shown already have higher rates of depression, anxiety, and poor coping than the general population. The university has been active in mental health promotion and providing management interventions. For example, we have Mindful Mondays, we have free online exercise and counseling services. But with such high rates of student mental distress, it is easy for services to become overwhelmed. In the meantime, our students may be engaging in unhealthy methods of coping. In the school-based survey that I referenced a little while ago, while many students reported a wide range of healthy coping strategies, 46%, that's almost half, acknowledged that they were using unhealthy means to cope, including the use of alcohol and drugs, escapism, overeating, binge TV watching, isolation, and avoidance. In another survey of students in the faculty that was done by a group of Year 2 medical students, it is reported that during the COVID-19 lockdowns, the proportion of students who drank alcohol most frequently, that is those who were drinking at least weekly, increased significantly from 13% to 23%. Those with higher COVID fear scores, those who were more afraid of COVID, and who reported more increases in their anxiety and depression, were the ones who were more likely to increase their substance use. All the students who reported an increase in depression increased their substance use. Students who reported increased anxiety levels were also 4 to 5 times more likely to increase their use of nicotine through smoking cigarettes or vaping. The main stressors they were coping with were again academics and home life. While your IQ gets you into uni, it is your EQ that keeps you healthy along the way, whatever the crisis. We're talking here emotional intelligence, awareness of and ability to manage emotions in a healthy way. Social scientists have determined that even in academic contexts, emotional intelligence influences your stress levels and their satisfactory management, with benefits in both emotional levels and academic performance, and it can be learned. So in my remaining minute, I want to quickly share 4 tips that we can all use on our own to improve emotional intelligence and promote good mental health. The time does not allow me to elaborate, so I will send you home to do some homework, but I will tell you what you will be looking for. Number 1, become emotionally self-aware. Learn how to identify, label, and own your emotions. Research shows us that when we label difficult emotions like fear and anxiety, the amygdala, a brain structure that registers danger, becomes less active and is less likely to trigger a stress reaction in the body. Secondly, manage your emotions. While we cannot control the pandemic and all that it brings, once we recognize our emotions, we can control our emotional responses and how we behave. Meditation techniques are very useful in this regard. whether mindfulness meditation or prayerful meditation. Thirdly, promote general emotional well-being and healthy coping through these two evidence-based activities. Firstly, exercise. We know about the endorphins that are released when we exercise, but recent research shows that regular exercise also produces endocannabinoids with the same mind-altering effect in the brain as THC from marijuana, but without the risk of harm. That's how we get our exercise euphoria. The second evidence-based intervention is gratitude. People who regularly express gratitude for the positive things in their lives, tangible or intangible, have lower rates of stress and depression. There are things we can be grateful for, even during a pandemic. Find them and give thanks for them. Lastly, make sure that we all have social and emotional support. If you need it, seek help. If you have it, help others where you can. Thank you very much.
Good evening, all. My name is Dr. Carla Maria Alexander, and we are going back to vaccines now. And I just wanted to give a brief overview on the two vaccines that are in the public health system in Trinidad and Tobago. And those would be the Oxford AstraZeneca and the Sinopharm. Now, the Oxford AstraZeneca is what is known as a viral vector vaccine, meaning that the vaccine is given utilizing a common harmless virus to introduce genetic information about the spike protein to the recipient, thus allowing the immune system to see and recognize the spike protein as foreign and mount an immune response in case the individual is then exposed to the SARS-CoV-2 virus. Their immune system will be ready to fight the SARS-CoV-2 virus. The Sinopharm vaccine is what is known as an inactivated vaccine. So it is the whole SARS-CoV-2 virus that has been inactivated. So it is not infectious, but it is once again introducing the immune system to the virus, thus preparing the immune system to fight it in case the recipient is exposed to the actual infectious virus. Now, there are common side effects that are usually associated with vaccines, and these can include fever, pain at the injection site, headaches, fatigue is another common side effect, and these are common side effects that can be experienced with both the Oxford AstraZeneca and the Sinopharm vaccine. Along with the common side effects, some vaccines have serious or adverse side effects that are rare. With respect to the Oxford AstraZeneca vaccine, we have the rare incidences of VITT, which is vaccine-induced immune thrombotic thrombocytopenia, or as is commonly known, we see clotting, but these are very rare events. And in fact, studies in the UK showed that for 1 million persons who have been vaccinated, the rare side effect of clotting was seen in only 5 persons. So 5 in 1 million doses, you would say. The other, with respect to Sinopharm, common side effects are the ones that have been most known with respect to that vaccine. So there hasn't been any rare side effects seen in the public domain with respect to the Sinopharm vaccine. And what should be noted with respect to the clotting is that if you do get infected with SARS-CoV-2 and you have the COVID-19 disease, you have a risk of still having clotting being one of your symptoms. And it is an 8 times greater risk of clotting occurring if you get COVID-19 versus if you get vaccinated with the Oxford AstraZeneca. So in conclusion, I just want to urge everyone to be informed about the vaccines that are out there and then make a wise decision. I thank you.
Hello, good evening all. My name is Philip Onuoha. I am from the UWI School of Nursing. And this evening I'll be bringing the conversation to how vaccine may be administered. Vaccine, like any other medication, can be administered through many routes. But the corona vaccine that we're talking about, the ones we have in Trinidad, is administered into the muzzle. Using the muzzle to administer vaccines has a lot of advantages. The muzzle, we know, is very richly supplied with blood, so it makes absorption easy, and it makes absorption easy, and it's also fast and quick, that whatever effect that we get from the vaccine will be soon and effective. And in this case, the preferred muzzle of use for the vaccines administered in Trinidad is the arm muzzle. The arm muzzle is also called the deltoid muzzle, and the reason it is preferred is because it is very easily accessible to the person who is administering the vaccine. That is a nurse or a medical personnel. Even the individual who is being injected is also very easy for the person to show that part of the body. And there is not a lot of undressing to do. We also know that the vaccine that is being administered is very small in quantity. The muzzle in the arm is large enough, is considered large enough to accommodate it without any major issue. And also, that arm muzzle is easier to also observe. Anybody can observe it. You, who is the person injected, you can always feel when it is swollen. You can always see when it is red. If there is anything in it or pertaining to the place that you had the injection, it is easy for you to observe it. These are some of the reasons why the arm muzzle is preferred. And what is important in the end is for you to relax yourself. Just be relaxed when you are getting the injection. It's a very small quantity of the vaccine that is being injected. Oftentimes, you may not even feel the needle prick because it's very tiny quantity that is injected at a time. And even the side effects that is talked about sometimes, these are really reactions or responses, the individual responses that everybody gives when the vaccine is introduced into the body. And so, of course, the health personnel who gave you the injection would have indicated to you what to do if you experience any of those effects that have been enumerated earlier. But I tell you, WHO says that vaccination is a simple, safe, and effective way of protecting people against harmful infections such as the coronavirus infection. And I tell you also that as we speak, more than 29.2 million people are getting the jabs just as we speak, every day. But sadly, some poorer nations are lagging behind in this. It therefore means that if you have the opportunity to receive this jab, by all means, please grab it. Thank you very much. I welcome your comments when at the end.
Okay, so my turn now. Very grateful for the help of my colleagues here in getting the ideas across. I hope that you are with us on this one and that you are understanding where the faculty is coming from. So I want to talk a little bit about balancing the risk now. Carla told us about the rare side effects. Now, it seems that Sinopharm so far hasn't had any of the sort of reported rare side effects that that we've seen for the, say, the Pfizer vaccine or the AstraZeneca vaccine. So I will confine most of what I'm saying to the AstraZeneca vaccine. As she told us, in 1 million people, about 5, some studies a little more than that, maybe up to 10, will get this very rare clotting disorder. It appears that the clotting disorder is more common amongst younger people than older people. The reasons for all of this, not quite clear at this stage. That being the case, how do you balance that risk? What does it mean? So we've told you for 1 million, it's somewhere between 5 and 10. Let's look at Trinidad and Tobago. What's the frequency of motor vehicle related deaths? I think in 2019, it was reported as 163 per million, but you would still get into a motor vehicle when offered a lift. And most people want to own a motor vehicle. What about a plane crash? Estimated worldwide, the risk of death from a plane crash is about 5.3 per million. That is about as rare as what Carla told you about the clots that you can get with the AstraZeneca vaccine. But yet you would go on a plane if offered. So what I'm getting at, I hope that I've given you here a real feeling for how rare the condition is. And the next question I want to say is that while I've told you about deaths from a plane crash, I didn't tell you about deaths from this. The death rate is very, very low. So while you may get 5 or 10 in 1 million, the number of people who may die might be 1 or 2 out of those. Now, I want to address the issue of deaths now from the virus itself. Our death rate in Trinidad has been hovering around 2.5%. In 1 million people, since we are looking at millions, that translates to 25,000. But the deaths are a very small part of the overall 20% who wind up in hospital, who are sick enough to need medical care. The other 80% don't. But of those deaths, you also have another 2.5%, so 2.5 deaths yet, but about 2.5% recover from intensive care, and the other 15% are in a hospital but don't need intensive care, and then they are discharged. But out of those groups, that's those who were in hospital and are discharged, and those who were not, there is yet another syndrome. It's called long COVID. Long COVID is the persistence of the COVID symptoms. And certain complications can occur after a month. They're all clot related. You can get heart attacks, you get strokes due to the virus. And just remember, one of the main reasons for going to the hospital is this pneumonia that people suffer from. That also is due to clots, due to the virus. So you're battling a rare complication of a vaccine, which is clots, against a very common complication of the virus, which is clot-induced or clot-associated. Now, long COVID is the persistence of these symptoms for weeks, months, sometimes longer than that. There are some organ-specific complications, such as fibrosis of the lungs associated with the virus, cardiac complications, neurologic complications. Those are the three main areas, which occur afterwards, not necessarily during the acute illness when you're in hospital. Long COVID appears to be more common amongst the younger than the older people. Again, the data here is still evolving. The post-viral fatigue syndrome affects a number of people. That is, you try to do your daily activity and you're just tired. You just can't cope with simple things. And it takes, again, a variable length of time to go away. All of these are reasons for you to take the vaccine when offered. I want to stop here now because we need to have a chance to think about and have a discourse. So I want to thank the team, particularly Professor Ora, because where he is right now, it's after midnight. But he has been very participating all the time, though he's far away with the faculty. And I want to thank my colleagues for taking the time after hours to come out to speak with you. Thank you very much.
Okay, members of the panel, I will ask kindly if you can start your cameras and I will address the questions to you. Starting off, I want to ask Dr. Alexander to address, is the Sinopharm vaccination safe for pregnant or breastfeeding women? Can you advise?
Hi, good evening. Sorry, you caught me off guard. I must admit you caught me off guard with that question. I am not sure, and I would accept help from the rest of the panel on this, with respect to breastfeeding women with the Sinopharm vaccine. I do believe that permission has been given with respect to pregnant women, but I can be corrected on that instance by anyone on the panel.
Yes, you're right, Carla. In the interim, WHO recommends the use of COVID-19 vaccine in pregnant women when the benefits of vaccination to the pregnant woman outweigh the potential risk.
Right.
Okay, thank you. The next question is related to Sinopharm again. And the person asks, is it safe for hypertensive patients or persons who have cardiovascular issues? Can you advise?
So that is the reason that you take the vaccine. Remember, the death rate is more is higher in the elderly people, and in large part it's because of comorbidities. So people are worried. I mentioned the effects of the virus even after the acute situation, but during the acute situation, it causes cardiac complications. It causes respiratory complications. So people who already have diseases of these systems should be more inclined to take the vaccine.
Okay, on that same note, similar question, is it advisable for me to take the Sinopharm vaccine if I have a blood disorder in which I experience spontaneous bruising and hemorrhaging?
Okay, I don't know if any of my colleagues, I don't want to monopolize things. People can feel free to shoot in if they want. Okay, so they're leaving that to me.
I mean,
Chris, did you? Oh yeah, Chris, go ahead.
I'd just like to reiterate what Prof. Simongal says for people with underlying health conditions, it's all the more important for them to take the vaccine, because we've known from the very start with this virus that certain groups, including elderly people and people with underlying health conditions, like you mentioned, that are far more susceptible to getting the severe consequences of this virus. However, there are some cases when it may, and I'll revert to Prof. Simongal here, when it may be a good idea to talk to your doctors if you have certain conditions involving blood and inherent conditions where you're more prone to clotting. It may be worth speaking to your doctor, but we have a doctor here, so I'll revert to Prof.
Okay, yeah, sure. There is no clear answer to that question. Why? When the studies were being carried out, patients with these severe sort of conditions were left out of the studies for very good reasons. Because remember, it was an experiment that was being done, or as all clinical studies are. So we don't really know the answer to your question. So in such a case, what you need to do is to speak to your personal doctor who knows your condition very well and have a fair and frank discussion with him or her about the pros and cons of having the vaccine. There is no evidence thus far that the vaccine causes any bleeding complications. But there is the issue in the case of the AstraZeneca vaccine of the low platelets, which is associated with clotting. It's a consumptive sort of, you use up your platelets, which are the cells that bring about clotting. You use them up because of the clots that you're being formed. So it's not that it's a bleeding disorder. So I would urge caution there, and I think it's a good question, but one that requires discussion with, and also the drugs that you are taking may impair the immune system response. So all of these things need to be discussed with your personal physician.
Thank you. So I'm going to group these two questions. This person is asking, with regards to the efficacy of the vaccines against the variants, can you please speak to the efficacy of the vaccines against the variants? Is one better than the other? And what is the difference, once again, between the AstraZeneca and Sinopharm vaccines?
Perhaps Carla and Chris could give their views on that.
I can kick in first if you like. I mean, the take-home message is, as I said in my talk, that all the vaccines are safe and effective against all the variants. There are some subtle differences, as I talked about. In some cases, there may be slight reduction in protection when it comes to symptomatic disease or when it comes to transmission. But the key thing that you need to really take home is that all the vaccines are going to significantly protect you from severe disease and death. It doesn't matter which ones, all the ones that we have in Trinidad and Tobago. And that's the really critical thing that you need to take home.
Okay. And the differences between the Oxford AstraZeneca and the Sinopharm, just think of it as two different types. It's two different platforms. The Oxford AstraZeneca, it's what is known as a viral vector vaccine. So it's basically they're using a common harmless virus to transport the genetic material for the spike protein, that important protein that Professor Ura spoke about with respect to SARS-CoV-2, to introduce it to the immune system so that the immune system can now mount a response and be prepared if you happen to actually be exposed to SARS-CoV-2 virus. The Sinopharm is what is called the inactivated type of vaccine. And it's basically where they have made the SARS-CoV-2 virus non-infectious, it cannot replicate. So it is just, once again, a way to introduce the virus to your immune system and allowing your immune system to be prepared to mount an immune response so that now, if you happen to be exposed to the infectious SARS-CoV-2 virus, your immune system knows what to do and mounts an immune response much quicker and able to, as Professor Ura said, not have you get seriously ill, not having to go to the hospital.
Thank you. Professor Ura, given the nature of the virus to mutate, would you be able to just shed some light on whether the booster shots for different vaccines, how those would work, and what would be the process for that?
Yeah, that's a very good question. So what the scientists are looking at very carefully is they're looking at these mutations to see the consequence of them on whether they will enable the virus to evade the immune system and whether the vaccines will continue to work against them. And so far, so good. There haven't been significant mutations to make the virus or make the virus be able to evade the vaccine. And that's why the vaccines work. However, as I said in my talk, the more the virus is allowed to replicate around the world, the more variants we're going to get, because these mutations, these errors occur during replication. So the more replication, the more errors, the more mutations, the more chance of new variants. So we as scientists have to keep a very, very close eye on these mutations, especially that are changing the way it interacts with the neutralizing antibodies that I talked about and will affect the vaccine. And immediately we see something, if we see something, and it's not necessary, we won't necessarily see it, if we see a really significant set of mutations that affect that will affect the vaccine's efficiency against the virus, we will have to change the vaccine, which will be relatively easy thing to do. You just subtle changes in the vaccine, which will enable us to have a booster in the future of a vaccine that's better matched against the variant that is circulating at the time. So the scientists are onto this. We don't have to do anything so far, but we may have to do something in the future. We have to watch that space very, very carefully.
Let me just ask something to Chris here. Chris, is that similar to what happens with the flu?
It's exactly the same, Prof, as what happens with the flu. But the flu virus is slightly different in the fact that it's able to replicate and change even more efficiently than COVID-19, that our COVID vaccines. So it's one step ahead. It's replicating more, and it's doing other methods of changing. So it's really smart at changing. So we have to be. That's why we have to be really, really careful with the flu virus and the flu vaccine. And the flu vaccine changes every year pretty much because the viruses are changing every year. So it's exactly the same thing. Luckily, COVID is slightly slower at mutating, so we won't have to do it as much. We won't have to change the vaccine as much as we do with the flu.
Well, thanks so much for that, because that is something, and I know, of course, the flu is one of your major areas of interest. It is also, people see COVID as being so different from other viruses, but from what you're saying, it is similar. So I think people can get some reassurance from that. Thank you.
Thank you. So some of our viewers are indicating that they have gotten their vaccine and their first shot, and they have been experiencing some lasting side effects. Some speaking to having numbness of hands and feet, pain in the eyes, headaches for 3 to 4 weeks. Can you offer any advice on this, Dr. Onuwa, or any other members of our panel?
If having gotten the vaccination, you feel you have any of those side effects that I talked about, and you observe it for, you're saying, a week and two, check if it is serious enough so that you can also let your physician know that you have this. If it's a headache that is not going, so that they know how best to attend to it. But as Harvey said, these responses are according to different individuals. People experience them differently. Yours might be slightly different from another person's, and hence the reason if you experience it for a while longer than up to a week, like you're saying, it is perhaps important that you let your physician know, let your doctor know that this is what is happening so that he can advise you more appropriately.
If I could add something to that, to what Philip said. When you have an intervention and something happens after, it is very easy to say cause and effect. But because you have symptoms after the vaccine doesn't mean that the symptoms were caused by the vaccine. One, if you have an underlying medical illness, it can deteriorate on its own. Two, and it's very important, if you have COVID and you have the vaccine and the symptoms can start afterwards, for instance, for the Sinopharm vaccine, its full effectiveness takes place after this 2 weeks after the second dose. That's when I think you're fully immunized. I know Carla can probably elaborate on that later. But so therefore, within that period, you can get the virus. Now that burning sensation that is not a common side effect of the Sinopharm. I think they said with the Sinopharm, but it's not a common side effect by any means. And therefore, you need to look for other causes of it. You should not assume that it is the virus, the vaccine. So I would caution against attributing anything that happens to you afterwards to be due to the vaccine. It may be due, but please understand that it may be due to many other things. Thank you. Carla, maybe you could elaborate on the immune part of it.
Sure, Prof. What you said is correct, and that's for all the vaccines. The full immunization is 2 weeks after your second dose of your vaccine. That is when you are considered fully vaccinated.
Okay, great. So there is a question very specific here. It speaks to the Vaccine Adverse Effects Reporting System database. Any comments on the data that speaks about the side effects that may be rare? As when you're comparing the vaccines, a lot of them seem to be negative reactions. Any comments on this? The Vaccine Adverse Effects Reporting System database.
So well, obviously I don't have access to that. I'm not sure whether it's the Ministry of Health or CARPHA that's doing it. I do know that there is a particular officer in charge of collecting that data, but so far that has not been made public. So I'm not aware of what the answer is to that question. Sorry. I don't know if any of my colleagues know, but I'm not aware.
Okay. What are the WHO criteria for vaccine approval? Can you speak more to this? And are the vials of the Sinopharm vaccine actually received and that being brought to Trinidad WHO approved?
Want to take that one? Carla, do you want to take that one? I don't. I can give an answer, but I don't know the full details.
Well,
I think
I'm
please.
not sure how exactly to answer that question. I guess I'm not sure what you mean by what exactly are the WHO. Yeah, because it's a very detailed process. They have various groups of scientists going through the data that has been provided by the vaccine manufacturers. So I guess I don't know what specifically you want the question is trying to glean. And
Chris, sorry, no, go ahead. So Chris, do you want to comment? I mean, they have this group called SAGE, which is Strategic Advisory Group of Experts that looks at all of these things in detail, but I don't know much about how they work. Chris, do you have any idea?
I mean, just really to say that the WHO are and a big group of scientists affiliated with the WHO are looking very, very carefully at the clinical trial data. So these vaccines all have to have have to go through very stringent clinical trials, which indicate, you know, that how safe and effective they are, and this involves a series of trials from 1 to 2 to 3, and so in the end they go into a lot of people, and that data is examined extremely carefully, both the safety and the efficacy data, by not only the individual regulatory groups within the countries, but also by the WHO scientists. And so they would have to go through this very, very stringent process before the WHO would say that these vaccines are safe and effective. And the answer to your second question, I think, was would the Sinopharm vaccines have been approved? And I think the answer to that would be yes. The Sinopharm vaccines have been fully supported by WHO. And they would have come from bona fide production companies in China. So yes, they would have been approved by WHO.
Okay, thank you. How long does each of the vaccines last in the human body in terms of providing protection?
That's Carla. Carla?
Yes, I'm here. So you're asking how long is the immune system going to be protected because of receiving the vaccine? And the best answer would be this is an evolving situation. So it's basically data is continuously being collected on persons who have received the vaccine and looking at their immune response. So Professor Ura just stated about the different phases that all vaccines go through. And there's a phase called the phase 4, which is after the vaccine has been approved. And this is where they are continuing studying the effectiveness of the vaccine in the general population for a long period of time. So at this point in time, we cannot say this is the exact date when the vaccine will stop being effective. It is a continuous process of us looking at the immune response of the vaccine.
Yeah, that's right. The initial study went on maybe for 3 to 6 months. And we know they were effective up to that time, but to understand that aspect of the vaccine use, you'd have to have a study that's going on for 3 or 4 years, which is what Carla is referring to in terms of the real world studies or phase 4 studies.
Okay, thank you. So I'm going to actually invite Professor Indar Ramnarayan, the campus deputy principal, to address some of the questions that have come in specifically with regards to the campus's upcoming vaccination exercise. Professor Ramnarayan.
Thank you very much, Chanel, and good evening, everyone. Special good evening to our students and our staff, and of course, the panel. So we would have received a small batch of vaccines, AstraZeneca, about 3 weeks ago. And those were meant specifically for our medical science students, our clinical students who were on rotation. And this was really meant for them to get vaccinated and so able to go back to the wards for the clinical training. So that was a small batch. Not all the vaccines were utilized, and we were able to use extras for other students as well as some members of staff who had to come out to work. But we have been promised a larger batch of vaccines. In fact, we received some a few days ago, and we are going to get some more in a couple of days' time. So we are going to start a mass vaccination program from Monday. In fact, we opened up our website just yesterday. Within 4 hours, the Monday session was completely booked. We had over 1,200 persons booking appointments for Monday. So that was a really good response. It shows that many people are very interested in the vaccines. So we're going to vaccinate students and staff in the first phase And later on, we will vaccinate other persons like retirees and so forth, and persons from some of our affiliated institutions, Athalog Jack, Roy Tech, Cuban Law School, and so forth. So that is going quite well. We have advertised it widely. We have sent emails to all students, all staff. We have been sending reminders through marketing communications. We have launched a website where anyone can go well, students and staff can go and book their appointments. So we will start from Monday vaccinating persons who are interested, and that will be done at the University Inn and Conference Center from 8 a.m. to 5 p.m. every day. And we're going to continue on until we take care of all persons who are interested in getting vaccines. Thank you very much, Chanel.
Before you leave us, Professor, just want to ask you to reiterate the persons that are eligible for the vaccines, as well as what vaccines will be available to the university students and staff, as we do have some people asking for clarification. We do have our outgoing students, who will be graduating this year. They want to be sure that they fall under the criteria to be vaccinated. So if you can just share again and to reiterate who will be eligible and the vaccinations that we will be receiving, that we will be receiving from the Ministry of Health.
Okay, so the vaccines that we have received are the Sinopharm vaccines. So that is what we'll be using in our vaccination drive. And at this point in time, all registered students and all current staff will be vaccinated. So students who have been recently awarded their degrees, they will still qualify because they're still registered students. So basically all they need to do is go onto the website and book an appointment for those vaccines.
Thank you. Just one question again. I'm not sure you'll be able to comment on this, but just to let the viewers know that we are posing a question to you to give some guidance with regards to if the vaccinations will be mandatory for all students and staff. Can you please advise?
Well, that's also a really interesting question. But we are not saying that the vaccinations are mandatory for students and staff. What we are saying is that we strongly recommend persons taking the vaccines. And for persons who would have viewed the session today, and I think it was excellent, I really want to thank Dean Simangal and his staff for producing such a high quality event. If I had doubts about taking the vaccines after viewing today's session, listening to the speakers, I would have no doubts. I certainly will go and take the vaccine, especially with some of the comments that Dean Simangal made about the effects of COVID, and he spoke about long COVID. I think that is serious enough for anyone to take the vaccine. And remember, we have a choice. We have a choice now. The vaccines are available, and we have the choice to take the vaccine or not take the vaccines. Many persons in this world do not have that choice. In many countries, vaccines are not available. We are very fortunate. I mean, we have to wait a while, but we are very fortunate to have the vaccines available now. In fact, in my own family, I lost two members of my family. I lost an uncle earlier last year. He lived in Canada, and he picked up COVID and he died. He was in intensive care for 2 weeks. He struggled and eventually he died. And at that stage, the vaccines were not yet developed. So he had no choice. He couldn't do anything. And just a few months ago, a cousin of mine died. And at that time, the vaccines were not available in Trinidad. So again, he had no choice. But we have a choice. We have a choice. And I'm hoping that people will think about this carefully. I know there are persons who are still skeptical. I know persons still need more information. But COVID is real. The pandemic is real. People are dying. People are getting ill. And it'll take a long time for them to recover. So I think people need to be very careful, think very carefully, and make that choice. We're not saying take it. We're not saying don't take it. All we're asking you is to listen to the facts, and make a wise choice. And remember, that choice is not only for you, it's for your relatives, it's for your friends, it's for the community, it's for the country, but most of all, it is for the world. And Professor Ura spoke about the pandemic, and he spoke about the variants. And the only way we could stop those variants is to vaccinate as many people as we can in the world as quickly as possible, so the virus do not get a chance to evolve and develop into these variants. And the only way to get out of this pandemic is through vaccination. So I'm really hoping that persons who are listening will listen carefully and make that wise choice for everyone. Thank you, Chanel.
Okay, thank you, Deputy Principal, members of the panel. That's it for questions. Over to you once again, Professor Simanko.
Oh, well, my boss has spoken. What more can I say? I would like to thank my staff for coming out at this hour to speak to all of you. We are grateful that you gave us the time to share our views with you. And I really want to thank the Deputy Principal for putting it so nicely, tying it all together with his comments and giving his own personal experiences. Thank you very much, Chanel. And of course, thanks to marketing and all of those who helped to make this event possible. Thank you.